Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, I will discuss the top 10 key statements from the 2023 American Heart Association, AHA, American College of Cardiology, ACC, Multi-Society Guideline for the Management of Patients with Chronic Coronary Disease. This societal statement was published in the Journal of the American College of Cardiology, JACC, in August 2023. Here are the top 10 take-home messages from the AHA/ACC Multi-Society Chronic Coronary Disease Guideline 2023. 1. Team-based, patient-centered care. Patients with chronic coronary disease should receive care from a team of healthcare professionals that includes a doctor, nurse, pharmacist, and other specialists. This team should consider the patient's social determinants of health, such as their income, education, and housing, as well as the cost of care when making shared treatment decisions. 2. Nonpharmacologic therapies. All patients with chronic coronary disease should be encouraged to make healthy lifestyle changes, such as eating a healthy diet, exercising regularly, and not smoking. These changes can help to improve cardiovascular health and reduce the risk of future heart problems. 3. Physical activity. Patients with chronic coronary disease who are able to exercise should be encouraged to participate in habitual physical activity, including activities that reduce sitting time and increase aerobic and resistance exercise. Cardiac rehabilitation can also be beneficial for these patients. 4. Sodium glucose cotransporter 2 inhibitors and glucagon-like peptide 1 receptor agonists. These medications can be helpful for some patients with chronic coronary disease, especially those who have diabetes or are at risk for developing diabetes. 5. Beta blockers. Beta blockers are no longer recommended for all patients with chronic coronary disease. They are only recommended for patients who have had a heart attack in the past year, have a left ventricular ejection fraction of less than 50%, or have another condition that requires them to take beta blockers. 6. Lipid-lowering therapies. Statins are still the first-line therapy for lowering cholesterol in patients with chronic coronary disease. Other medications, such as ezetimibe, proprotein convertase subtilisin, casein type 9 inhibitors, inclisiran, and bempedoic acid, may also be helpful in some patients. 7. Dual antiplatelet therapy. Shorter durations of dual antiplatelet therapy are safe and effective in many patients with chronic coronary disease, especially those who are at high risk for bleeding. 8. Non-prescription or dietary supplements. There is no evidence that non-prescription or dietary supplements, such as fish oil and omega-3 fatty acids or vitamins, are beneficial for patients with chronic coronary disease. 9. Routine periodic anatomic or ischemic testing. Routine periodic anatomic or ischemic testing is not recommended for risk stratification or to guide therapeutic decision-making in patients with chronic coronary disease. 10. E-cigarettes. E-cigarettes increase the likelihood of successful smoking cessation compared with nicotine replacement therapy. However, because of the lack of long-term safety data and risks of sustained use, e-cigarettes are not recommended as first-line therapy for smoking cessation.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.